for the basic concepts of diffusion tensor imaging. Also, I will talk a bit about the fiber tracking, the scan method that's used inside the scanner, and how to modify and how to use the parameter inside this application. I will give you such types for this application and the post-processing inside the MR system. Also for on ESP, which is the tools that Philips used as a post-processing. So the clinical application for the diffusion tensor imaging is used to investigate the development disorder which can affect physical ability, such as the vision, such as the mental ability, such as learning. Also about the neuroinfection, I'll give you some example like encephalitis, and which is an inflammation of the brain, meningitis also, which is an inflammation of the membrane that's cover the brain and the spinal cord, which can be caused by either bacteria or a virus. Also, I will talk about the radiation oncology and how to use the diffusion tensor imaging to the plan the treatment. Also, I will give the fiber tracking, but the fiber tracking as a main application used for is to do some pre-surgical planning or to making a decision and to find the relationship between a brain lesion and the fiber bundles. So one of the basic concept of the diffusion tensor imaging is and the fiber tracking is to visualize the white matter tract and the brain, where diffusion weighted imaging is based on a random motion of the molecules of water. And this modelization of this diffusion data that can use it in diffusion tensor imaging can exploit the directionality of the property of the water movement. So the diffusion in the wave matter is often strongly anisotropic, also to occur a maximal of the same orientation as wave matter attract. So the diffusion tensor imaging is used to visualize the wave matter tract. Also, the fiber tract can be combined with, for example, as the functional MRI with bald contrast that I'm talking about the Friday for some purpose like surgical planning. So this is the fiber tracking for treatment planning, which used with the different direction. You know, that's to do some modelization of the diffusion weighted data. So we can use as lower for 6 direction or medium for 15 direction, or to be high in 32 direction. That's you can find in your Philips machine. And the fiber tracking of neurodevelopment that you can see here in this picture, that's you can find the different bundles that you found in 50 months by using the fiber tracking. Also, you can find in 3 years. That's here we can see the development of the fiber bands inside our brain. So, and elderly, you can see here it's more visual for the tractography. So we don't talk about the diffusion tensor imaging without talking about the diffusion anisotropy, which is talked about the movement of the molecule of water as a free diffusion, which make isotropic diffusion. And if there is, for example, a restricted diffusion that can give us anisotropic diffusion, and we will see later how can give us some value of this diffusion if we talk about isotropic or anisotropic one. So this is a characterization for the anisotropy. That's what I'll talk about to the example. Here we cannot talk about the ADC, which is a reconstruction, which talked about the equal ADC that's reflect anisotropic and the free diffusion. Anisotropy is only can talk about it, it's only determined by using 3 different diffusion directions. To calculate the anisotropy in the 3D models, diffusion measurement in 6 different directions are required to characterize the shape and orientation of the ellipsoid. This is technique called tensor imaging, and which talked about diffusion tensor imaging. That's we talked about the eigenvalue, and yeah, that's give us in 3 direction and give us the which is called tensor imaging. So also this is one of the main characterization of the anisotropy. It's only determined by using 3 different diffusion direction. Here, even maybe we can go more than 32 direction, which is called by using, for example, 128 direction, which is high angular diffusion weighted imaging, hardy, and which accomplished with up to 128 direction. So in the research environment, there is a different variant of diffusion tensor imaging are used to investigate tissue, microstructure, and neural connectivity, which the main idea is to visualize crossing fiber by utilizing different models in the research area, like diffusion spectrum magnetic resonance imaging, DSI, which is developed to image the complex distribution and travoxel fiber orientation. Also, there is the hardy one, which is an high angular resolution diffusion imaging, which is a variant of diffusion MRI and measure the diffusion of photomolecules along the angular gradient direction in the key space. It provides better estimate of fiber orientation compared to the traditional or the conventional one used in diffusion tensor imaging. Also, there is the keyboard, which can resolve multiple and travoxel fiber orientation and does not require any assumption on the diffusion process, such as equationity or multi-equationity. This method makes use of a wide range of p-value, also a high number of diffusion direction. Don't forget, often the multiband sense, which is an application, it's an option on the Philips machine that's already buy if the consumer need the multiband sense or to accelerate the time of scan, also to give a better resolution or to go more than 32 direction, even 32 direction, or by using the Hardy model, when he tried to use 128 direction. The multiband sense can be used to reduce, as I said, the scan time, or to increase a little bit the spatial and the temporal resolution. So just I will talk about the anisotropy, the B0, and the list of 6 diffusion or 6 direction on our measurement are merged into a single outcome that will give us a map called the fractional anisotropy, which is we can interpret this image by if we see that's equal 0, which means that there is no movement, which is black, it's a totally isotropic, and if the fractional anisotropy is superior to 0, which see in the image as white, here it's anisotropic. It means like we have a more fiber that's or more bundles inside this region. So concerning the color, just to differentiate between 2 things, that's we can find the grayscale maps, which is the fractional anisotropy, which indicate which is a value that's indicate the anisotropy. Also, we have the color map, which is the color of the preferred diffusion direction, which is like, for example, if we found the blue that's talking about the corticospinal tract, which is the direction it's from to head, or when we talked about corpus callosum, for example, it's a direction from left to right, or sanguis, it's from anterior to posterior. Just this color, it's to indicate the direction of the fiber. Now we move on to the fiber tracking and the reconstruction. The fiber tracking algorithms can be used to automatically track fiber along the whole length in whatever direction that you want to be. For example, if you want to extract the tractus corticospinal, like which is responsible for the movement, and to, for example, when someone try to move hand or foot, just we can see that's there is an activation, for example, when we work with fMRI bolt or contrast bug in this bundle. So, and which is useful to the measure deficit in Y meta, such as seen in aging brain, also to visualize the disruption and displacement of a fibral lung tumor or a lesion. The estimation of fiber orientation and the strength is increasing accurate, and it has widespread potential application in cognitive neuroscience and neurobiology. Here we can give an example about the diffusion tensor imaging from University Johns Hopkins of Baltimore. Here we can see the real brain, and here there is a reconstruction by using the diffusion tensor imaging. It looks very, very, very nice image here, and all the direction. There is a different algorithm behind the image, but yeah, it's look very nice to see the bundles, the directionality, the fiber, the color. But you can keep in your mind, it's not a real fiber, but it's a reconstruction. Maybe you can find a base in the results, but it's estimate the orientation of some fibers. So concerning the scan mode that used inside the Philips machine, maybe we can use a single shot with ecoplanar imaging, spin echo with ecoplanar imaging, which can give us a fast to freeze motion. Also, the average of the high B set to user defined that you can use different value of B value. That's what you want inside. For example, if you could do brain imaging, you can use, for example, 1000, 2000, 1005. So it's dependent on the B value that you use. Typically, it's of the clinical B value, it's a range between 800 and 1000. So it's a little bit to use a small TE just to go to the T1. So yeah. And for the preset protocol, just as I said before, that's when you use a low directionality, that's with 6 direction. And for the medium, it's 15 direction. For the high diffusion tensor imaging, we use 32 direction. This by using the DTI. But if we go to high angular resolution brain angulation for the imaging, Hardy model, so we can go through 28. Sorry. Yeah, this can give us a more accurate diffusion information by using this direction or high direction, but it's a little bit longer scan when we use 32 direction or 128. Maybe we can go for 15 to 17 minutes when we use Hardy models, but 32, it's a little bit medium like the sequence, it's around 6 to 7 minutes with a good signal to noise ratio. Also, don't be sure that's using gradient over pulse that's can give you a good results and a good acquisition. So the parameters that I've talked about when you use the TR 3000 millisecond or a little bit higher to allow for T1 recovery. Also try to using the multiband sense, which can give you, for example, TR 2300. The multiband sense, like I said before, it's used to get a less time of acquisition. Also for a good resolution multiband sense inside Philips machine, it's the same like, for example, in Siemens simultaneous multi-slice. So it's a type to use a TE around 80 milliseconds or a little bit lower. These lower TE results can give you a higher signal to noise ratio and can give you a less of T2 decay. Also can it's a little bit less in TO to shine through by using the lower TE. If the TE also is higher, for example, around 100, then use a higher half scan factor. Hard scan factor, it's a theory like it's a phase conjugate symmetry technique use data from the top half of key space to estimate data in the lower half of key space, which mean it's a symmetry method that go under a variety of trademark name. For example, according to the vendor, Siemens use, for example, the term of HAL 4E, while Canon is used the abbreviation of AFI, which is asymmetric Fourier imaging. Also, Philips, Hitachi, each called the same name like half scan. As a parameter of a dynamic stabilization. So it's typically by using F0 drift, and which give us in long in long DTI scans, like by using, for example, 128, also in the 3 Tesla. The dynamic stabilization that give us can improve the image consistency, which used only on the 3 Tesla by applying F0 determination before each direction. I'm talking now about the multiband sense, which is used to acquire data faster and acquire more diffusion direction. The high multiband factor that can be used for diffusion tensor imaging is 4. Multiband sense 3, it's very advised to use it. Try to use a moderate sensitivity encoding, which is typically the technique of acceleration inferior to 2. So in combination with multiband sense to maintain a good signal to noise ratio. This is an example which used 63 slices. So to do the diffusion tensor imaging as a low and 6 multiplied by 6 B0 and 64 direction for high B value like 305, 700. So fix the protocol, the same TE for all B value. Here you found that there is a different parameter TE and TR around 100 millisecond and around 5,000 millisecond. The scan time is around 6 minutes, and using multiband factor. You see here there is a good image in terms of signal to noise ratio, and also it's not very long because for example, I give an example when you're using 128 direction, we can go through 15 minutes. This also, it's dependent on the system of imaging. Here we used an engineer elision 3 Tesla. So there is a type for multiband sense used in diffusion tensor imaging. Use limited multiband factor, for example, 2, because TR should be high enough to allow like all image, the T1 relaxation. The acceleration doesn't reduce the scan time, you know. Also, for the signal to noise ratio decrease with a higher multiband factor. If we can go through to 4 or 5 as a multiband sense factor, maybe we can get down to 70 or 60% of the signal to noise ratio. Also, the SAR parameters, maybe we can increase when we can go to 4 or 5. So just keep to maintain the multiband sense factor in 2 or maximum 3. Use an integer number of slices. For example, multiband 3 or in 5 slices, we can give you or to accurate 15 slices. Also, it's very sensitive in to the susceptibility artifacts, which can give you a bad image. So try to make sense in this parameter, and also try to integrate the B0 map to correct for homogeneity, also in different multiband sense value. So here also we can by using sense encoding in slice direction may cause you some artifacts in your imaging, like B0 homogeneity, which here like an artifact You see here like the eyeball ghosting, which by getting different slice from other multiband slice. So slice also within one excitation are too close together by increasing the coverage. Also, there is types by using into small brains like in pediatric ones. Here, just try to apply sensitivity encoding or propeller or grappa one like Siemens or G1 by different types. So when you're using short equiplanar imaging factor, we have less distortion. But when using short PI reduct, we can get less image blurring. So for different p-value, lower p-value result in more SNR. Also, the high p-value result in term, first of all, in the more diffusion sensitivity, also more accurate display of fiber. So when we go to p-value 100 or 800, we can see more fibers. Also, in terms of using more diffusion direction result by using, for example, six direction, we can get more accurate fiber direction or by 32, sorry, and but we can get this more direction and a good quality of image, but it's a little bit longer of scan. So the advice or the types just to use, for example, if you have the sensitivity encoding, try to use the sensitivity encoding or the parallel imaging. If you have the option of the multiband sense, try to use the multiband sense because gives you more, less time in time of acquisition. So concerning the fat suppression, usually the spear method of suppression is more faster, but spare gives you more beta of fat suppression. So using also gradient reversal fat suppression lipo, which is available only on 3 Tesla, like engineer elation S or elation X, it's dependent on the gradient. Also the conventional Chiba 1 3 Tesla. You see here that's spare. It's good, give you better fat suppression. There is no fat, but yeah, but it's a little bit long than the spear one. Here there is some artifacts. It's not artifacts, but the fat is not already with a good suppression, but in term it's very fast than spear one. So now we're moving to the post processing because there is two way to do the post processing. If you don't have, for example, this option inside your IntelliSpace portal, you can get it through the system, which means that the radiologist or the technologist can do which type of post processing of this data on the MR system. And there is the only the other way. It's inside the IntelliSpace portal, and we will see together the both of them. So the post processing, there is 3 steps. First of all, we start by performing our the diffusion registration, also to generate the second two. It's an optional one to generate the fractional anisotropy map. Also, we can do through the MR system the fiber tracking. For the diffusion, the registration, it's also around to remove the different eddy current movement or the effect during a movement. So yeah, by applying diffusion registration, you can get a good image quality, which is calculated in the diffusion image. Also, you can the image of successful diffusion direction are very good. The registration also can quantify the amount of the motion, and also then to align the image, which given by an automatic registration to be added in your exam card. So you can find this in your exam card. Also, we can generate a fractional anisotropic map, which is an optional and can give you, for example, here the different value of 0 in the dark or near to 1, 0, for example, here 0 to 7, or when you go to white, it's a value that's superior to 0 and between 0 and 1. So, and this is like I talked about, it's the directionality or different direction of different bundles. Here, the SEP3, also we can do it through the MR system and through the console of acquisition. You can go the fiber tracking by a right click on the registration diffusion tensor imaging and to select the fiber track package with this icon. So, and drag this image through your console as a 3D anatomical series into the main viewer. So you can get the diffusion tensor imaging and you can drag it into your viewer. There is a different fiber track ROI that you can use. For example, freehand, which is only fiber track that can pass through all the defined and visible in which ROI you can draw on your image. So there is the seeded 2D image, which is used to identify with a single mouse click. The 3D one, it's also setting the algorithm to create a 3D region of interest. And there is here the single point, which is only the pixel within the single ROI. Inside the single ROI will be used to starting a point to find more fiber or different fiber. So here, just to generate some bundles, just by clicking the DTI here or fiber track icon here and track, for example, that CST one are generated, of course, if they meet the criterion and pass through all displayed ROI. You can see here how to choose different setting, like to use the slice coloring, or we can choose between FA or B0 or anatomical and to choose the different parameter like you want to see inside your system. Here we check that we see that's the coloring with a fixed one. So here also we can use lower minimum fractional isotropy to show more fibers, also to fix maybe a maximum or to use a high maximum angular change degree to show more, also to show more fibers. Also this parameter by using minimum fiber length, higher length, also to show a less fiber. Just when we use a higher minimum length show a less fiber. Here we can see different arrays that can we use. It's dependent on you, just when you use 2 or 3 or 4 bundles. The output, there are 2 output, the 2D cross projection track series. The 2D cross-section track, it's contain a reconstruction of the dataset with a cross-section of fiber per slice. So you can use different fiber, or you can use different slice, and there is a reconstruction of this fiber. And for the 3D one, it's a movie like a cine with of the dataset, which give you views, and you can define also the number of steps per view. Also can generate all series like you choose and you define it. Also it's a little bit to give you a movie that's maybe you can display this this image through the image view. So the second way, it's to do this post-processing inside the IntelliSpace portal, which is the application dedicated for Philips, which is a console separately of the MR system. And maybe we can do the same thing like by giving to perform the diffusion registration, also to generate maps, and also to do the fiber tracking. So inside the IntelliSpace portal, you can see this. You can see to click, for example, to preference and to go to the AMAR, also to the AMAR processing. Check enable here in the diffusion registration and click diffusion registration and to add here. And if you find this application inside your IntelliSpace, you can select the patient and click on the MR diffusion. This will give you a different direction and different parameters, different maps. Just check if you want to get the fractional anisotropy also with a grayscale or fractional direction with different color. You can also to generate this by saving this data, and you can also select different p-value by here. You can see the different mapping that's you have inside your application. Here, it's an example of different maps that you have. For example, FA directionality, that's the color of different parameter, also RA and axial diffusivity and radial diffusivity. This all the maps that you get after post-processing of diffusion tensor imaging data. So to do the fiber track on ESP, there is different steps that you can start with. It's to launch the fiber track package from the IntelliSpace portal, which is an application. I don't know if you can buy it or to through, for example, if you have or to do some upgrade of your system and to include this application on IntelliSpace portal. Also to check the alignment, just select the underlay and overlay. I will see later how to do these steps. And maybe we can use the guidance as help and to define and to track all the ROE. Also to include or to exclude some ROE. It's also an optional to exclude some fibers, for example, and to save that and to see the statistic before. After, sorry. This is the steps that we have. It's to launch. Just keep your mouse about the patient that you have, and after that, try to launch the fiber track by using the AMR diffusion on your IntelliSpace. And through this AMR diffusion, you can find here in this button, you can do the fiber track. You see here, just and to use a guidance if you don't know the instruction. Also try to use this when you get the FA, and here just choose the FA directional and choose to put any ROI in with any direction to select different fiber bands. You see here before analysis inspect the data alignment. It's mandatory steps. And also here, if you check your alignment by a local correlation or a cross correlation or whatever methods that you want. Also here there is to choose the FA directional or to do, for example, the FA directional or to choose some ephemeral maps, but here we talked about the fractional anisotropy. And we can select any anatomical series to underlay inside your image. And also we can use any type of ROE that we say before, also for the guidance and your help and of course I will move to how to edit and the fiber. So here the different ROE that's you want to use inside your FA map. There is here the different ROE that you want to use: a smooth counter or ellipsed one, C2D or 3D one, or a freehand counter. And you have the ability to scroll the plane position to a more or superior location. Then select the ROE here and or this ROE. And also you can select the ROE option from task guidance. You have that's before the task guidance here, and to choose the ROE that's you want to select. To also to click track on the fiber. Here you can see the fiber. And if you want to edit this ROE or to track which type of fiber like you want to include or to exclude, here there is an option. For example, if you have mentioned 2 or 3 ROE here, and right click and to see to exclude this track. Also, for excluding some fibers, just to draw a ROE through the fiber, and right click on the fiber and select edit. The fiber become in the color gray, and of course you can exclude it by right click on the fiber and to edit and to draw a new ROE, for example, on the right slice, and after that you can exclude it. It's the same things that here you see here. That's the image before. For example, if you want to exclude this part of this fiber, and you can see here after by excluding this fiber, you can see this only this image. Here, there is also by excluding or including or do any type of editing of the bundles. You can see here different statistic by different fiber like you use it, and different voxel, how many voxel inside your fiber and inside your, for example, when you use CST or corpus callosum art, this statistic can give you the volume of the fiber, also the fractional anisotropy, also the ADC, the length of fiber, and there is a different statistic about the fiber bands, and that's give you information about different use of the diffusion tensor imaging, like we said before. Here, maybe you can save these fiber bundles by clicking on this top, and after that, you can see different bundles that you have by viewing in the multimodality viewer. Just click right on the anatomical to add 3D or ortho view series and select. And here we can drop down, and you see all the bundles that you edit it excluded or to included, or yeah, and we can see your sample that you did with this option and this application. Yeah, thank you very much. I think I give you a little bit some gates for diffusion tensor imaging application inside the MR acquisition, also the Intel Space Portal. Yeah, thank you very much. And if you have some question, just don't hesitate to yeah to ask. Thank you very much. There is he yes, okay, there is no assistant. Francis, I already finished the presentation, so I give the attendees ability to ask some question. Sorry.
Hello.
Francis, yeah, thank you. I I searched for Francis. Hello? If you have some question, don't hesitate to ask.
Hi, Abderrazek.
Hi, hi, how are you?
I'm fine. I would like to ask you about the blob sequence. How can I increase the SNR? Every time when I did it, it's it's really grainy.
Yeah,
How can I increase the SNR?
yes, you can decrease increase your SNR by different way. Of course, by using an appropriate sensitivity encoding parameter by using, for example, two or three as a sense, or if you have the multi-band sense option, maybe you can use two or three as maximum. So don't use four or five because there is a problem regarding the SAR parameter. So yeah, and maybe we can decrease your voxel of acquisition a little bit. You can have a good SNR. Just
Yes,
maintain the multiband sense factor or the sensitivity encoding factor and the covering all the area of the your series, and you can get a good SNR. Yeah.
this is the way I did. But you know, I will lose my resolution. That's why.
Yeah.
Do you think
Yeah, that's right.
I increase my bandwidth and increase my NSA number of averages, is it a good way or not?
Yeah, that's right. Yeah, that's correct. That's correct by increasing your bandwidth, but just keep your eyes on the other parameters because when you change some parameters, there is other parameters goes down or to goes higher or to a little bit. Yeah, but to increase your bandwidth is can give you a good signal to noise ratio also. Yeah.
Okay, okay. Thank you.
Thank you, Jamaldeen. Thank you.
Thank you, Abdelaziz.
Hello.
Hello, Sarandra.
Can you hear me?
Yeah, of course. Yeah, I hear you.
Oh yeah, nice presentation. I just have one question. I
Yeah,
wrote here DTI. It's used for white matter tracks, right?
yeah, that's
So
right.
I'm wondering whether DTI can be used for gray matter as well. Yeah, that's my question. If you can use DTI for gray matter or not.
Yes. But you think that's DTI? It's covers all the brain, but you know that's DTI. It's a study of the water molecule movement. So yeah, and you know that's when you study diffusion weighted imaging, also under reconstruction or the modelization by using diffusion tensor imaging, it's to study the water molecule and inside the different fiber bundles. So just to study which orientation, which there is, we have restriction, where is the free anisotropy also or restricted anisotropy. And after that, we goes to the diffusion tensor imaging reconstruction. So the main idea is to study the Y meta abnormality, for example, but we can do it in the gray matter for sure. Yeah.
Okay. Yeah. Thank you.
Hi,
Thank
Abdul.
you, Surander.
So yeah.
Francis.
Yeah, sorry, I had an emergency. So yeah,
Yeah, no problem.
I'm
Yeah,
back here.
yeah, good. Just
Are you going to add
I
ASL?
sorry,
Are you going to add the ASL?
ISL.
Yeah, because we missed
Yes,
that last week. I don't know whether you're
yes,
going to
yeah. Of course, go. No, I finished it
the DTI.
Friday, the cell and board fMRI. I talked about the cell and board fMRI. So you have a question or something like this? Or?
No. I was
Yeah.
just asking whether you add that lectures as well, the ASL.
Yeah, I give the lecture already about the cell and the Bolda Famarai Friday. And today just the presentation is around the diffusion tensor imaging. Yeah.
Perfect. I have one question.
Yeah, of
And
course.
when you read in the literatures, they tell you like the white matters, it's like 21 toximetry. So if you do your DTI and generate all the fibers, are you going to get all those difference? Because I saw only like 3 directions, as you show with the color coding. I don't know whether we're going to get all that 21 directions on the DTI. Can you just throw some light on that for us? Thank you.
Yeah. Thank you. Just when we do the DTI through different direction, yeah, we can go the anisotropy as minimum with 3 direction. But as a modelization of the diffusion weighted imaging data, just by doing this modelization of the diffusion tensor imaging, we need 1B0 and 6 direction. Maybe this is the lower one. Which is a mathematical modelization of this data of the diffusion data, and we can go through 15 direction or 32 direction or 28 direction. So yeah, we can work with different direction. Just to keep in your mind that's here we can find the compromise of the acquisition time that you have. So when you want to go with more direction, just you have more time of acquisition. But if you put your application, or if you have, for example, multiband sounds or SMS through CMANS, you can reduce time scan. But there is also a parameter of SAR that's you keep your eyes on the patient that you have on your scanner. Yeah, of course.
Great.
Yeah.
So thank you. I think this is where we will end.
Yeah.
I don't
Thank
know.
you.
We still have 8 minutes. If some people still have
Yeah, of course.
questions,
Just I don't know for some users of Philips machine. I don't know in which release they have because there is a different release, and also inside the Intel Space Portal there is different release. 4, 5, 6, Intel 12, and there is the advanced release, advanced workstation that's launched by Philips this year, which is equal to Intel Space 15. That's between the release of 5 and the release 12, there is a little bit difference, but it's the idea is the same idea, but there is a different option. Also inside your AMR system, the same methodology and the same instruction and the same steps to do the diffusion tensor imaging post-processing. Just I will add, if you have any question or you need any guidance, don't hesitate to contact me through WhatsApp. We are all together with through the SWiM program, and we give help to each other and to correct with each other. Yeah, because there is a different system and there is a different Intel Space Portal version. So don't hesitate if you have a question or you need some guidance to come back to me through the SWiM program, of course, and we help together. Yeah, we help us together.
Yeah, that's good. I mean, now that we are moving to the practicum, I think more people have questions once they start using the machine. So once you are always around, we will just rely on you. And
my all ears, and I will give you assistance for some question or some technical expertise. I'm always here, and I can, we can interact together, and you have my WhatsApp and you have my mail also. Just, don't hesitate, as I said, because I don't know with which release you have. Just if someone have a question about some option, just send me the release that you have inside your machine. Also the version of your Intel Space, the version of your release inside your AMR system. And after that, we can interact together to find the solution of your problem. Yeah.
Good. All right, then I think we can end here. And it's great to see you again, and hope we catch up in the future. All right.
Thank you.
Bye-bye.
Thank you. Bye bye. Thank you. Thank you very much for all people. Yeah. Thank you.
Bye.
Thank you.
Bye.